Welcome to the 3-Minute Clinic, and today we're going to continue to talk about how to prevent the common cold during the winter season and the flu. That's right, we're going to talk about what you can do, how you can empower yourself so you don't get sick this season, so that when Christmas comes or the holidays come, you're having fun, you're enjoying your family, you're enjoying your friends, and you're not stuck socially in the bed and, oh, I can't go out and I don't feel well and the headaches and the backaches and the sore throats. So that's what we're going to talk about now, because most folks are going to talk about catching the flu. It's going around the office, it's going around the nursery, it's going around the school, and they're catching it, and they're suffering with it. That's what's going to happen. Now, here's what you have to know. And what's interesting to me is that many physicians don't know what I'm going to tell you right now. I'm going to tell you a secret that unfortunately most physicians don't know. Now, the number one risk factor for getting colds and flus is nutritional stress. That's right. What happens is, see, it's what we call the overstress, undernurtured syndrome. People are under high levels of stress. So when you have too much stress, which most people have, but when you undernurture yourself or eat the wrong foods, that sets you up to tilt. That's what the flu is. That's what the common cold is. You tilt. You see, your body has an overload. It has to rest and repair itself. So here's what you want to know. Nutritional stress is the single most important factor in developing the flu. Now, here's how I look at it. You know, I like my patients to do well, and I don't like my patients to beat themselves. And so what's the most important thing here? Those of you that follow sports know that turnovers make the difference. The team that has the most turnovers are unfortunately the team that loses. Well, when you eat the wrong foods, to me that's a nutritional turnover. Now, here's the thing you have to know. The most important thing from this lesson today is you have to know what not to eat. You see, knowing what not to eat is the most important thing in preventing the flu. There are 3 categories of foods that you must know that you want to stay away from. The number one food that contributes to the flu is eggs. You know, it's amazing to me. Mothers continue to give their kids eggs. You know, 7 to 8 out of every 10 visits to pediatricians, 7 to 8 out of every 10 visits to pediatricians are for upper respiratory troubles, sore throats, earaches, sinus infections, flus, bronchitis, laryngitis. Isn't it interesting that most of their practice is upper respiratory infection for pediatricians? And yet, do they realize that eggs are the number one thing that contribute to these problems? The second most common food group are dairy products, milk products, cheese, milk, yogurt, sour cream, mayonnaise. That's what we're talking about. And the third category of foods have to do with sugars, artificial sugars, meaning desserts and cookies and unnatural sweets, and refined white flour, the white rice, the white bread, the white pasta, the white foods. So here's what I want you to remember. To prevent the flu, you must know what not to eat. And the 3 categories of foods that you want to stay away from during this winter flu season when everything's going around, everybody's catching the flu, are eggs, dairy products, artificial sweets, and white refined flour. So that's the tip for today. Make time for wellness, know what not to eat, and make time to prevent the flu.